People living with dementia tend to communicate through behaviors because of their cognitive loss. These behaviors can be very challenging to caregivers. But it's important to note that dementia is the person's condition. It should be considered cause of last resort. It may be possible to track the causes of some of these challenging behaviors. The behaviors could be caused by a level of pain, side effects of medications, dehydration, hunger, and acute illness such as a urinary tract infection or a UTI, or constipation. Behaviors can also reveal if the person is tired and has not had enough sleep. Challenging behaviors can also occur due to the person's inability to remember important parts of their life. For example, remembering important people's names, such as a spouse, or son or daughter, and major life events, such as weddings and death. Sensory loss is also a factor. The loss of hearing, sight, touch, or taste can incite challenging behaviors as well. Other factors to consider. The person could be afraid of their surroundings. They may be lonely and depressed and are in search of comfort, nurturing, and reassurance. Their need for control is also a key factor and often the reason for challenging behaviors. As caregivers, it seems easier to do things for the person, but this is not always a good idea, especially when the person has always been independent. You may want to try and do things with the person as opposed to for them. Having behavioral outbursts and exhibiting challenging behavior may be their only way to express their needs, so communicate clearly your expectations. A person living with dementia may lash out verbally or physically because you communicated poorly, suddenly, or too aggressively. Performing the task itself can cause challenging behaviors. You're looking at individual preferences versus your preferences as a caregiver. What is most important to that person is what should be most important to the caregiver. The needs of the person should come first, and everything else falls in line after. What is being asked of the person may be too difficult. It may involve too many steps. Therefore, they may not want to perform that task at that point in time. These are all factors that could lead to challenging behaviors. Once all possible underlying causes are examined, then there is hope for possible solutions.